on the window ledge, right? Well, I wake up in the hospital injured, right? So I assume I was knocked out by the window ledge, of course. All right. Sorry, nudie pink popped up of a female vagina. Because I like looking at the women on YouTube, YouTube and dating sites, right?
Of the left sacroiliac joint with
Though someone's
elevation
acting
of
gay
the
about all
left
this.
hemipelvis relative to the right side.
But it's more complicated to get to my wife or someone off base. See, my ID's in the room.
Sacral fractures associated
So is my money.
with other
I took 250 out the ATM that night, right?
pelvic fractures are usually vertically
Or
oriented,
afternoon,
and it's
right?
important to
After
always
work,
check the symmetry of the sacral lines that
Now, I also had problems with my shipmates and got my E3 back
the
as
roof
well.
of the sacral foramina bilaterally. This is a normal sacrum. There are three sacral lines. There's the roof of the first, second, and third sacral foramen, and you should always look for the symmetry of the sacral lines.
Okay, another thing is sacral lines, right? No. There should be symmetry there. Mine have no symmetry anymore. In fact, mine's way over to the left again, I know, as if struck, right? He can raise me before, he can raise me again. The God that raised Jesus from the dead is my friend. Might not be your friend, but he's mine. But he's mine. Here's a better shot, right? Now, see this here, all this here is the sacrum, right? Right in here, right? Well, mine's out of alignment, right? To begin with, it's supposed to be straight and right here, right? Well, mine's all pushed to the left, right? And it's not centered, right? Well, see, this is your spinal cord right here. It's supposed to be centered here, right? This here is up way high, too. This is the left side versus the right, too. You see, one side's way up higher. As if struck. Again. Bioweapon. Now, I was in a car wreck at 16, but no serious injuries were, again, reported except for cuts in my hand, right? Which you see the scars of still today, right? So that is right there, a scar from the wreck, right? At 16, right? Well, it seems like someone don't want me to tell my story, and oh well, I can still tell my story. And, right. Mm. Mhm.
side to the other. They're smooth and regular. When there are fractures of the sacrum, as there is in this case, there is an asymmetry in the sacral lines. The left second sacral line, the white arrow is pointing to a discontinuity that represents a fracture, and the left third sacral line, the red arrow, is pointing to an irregularity that also represents a fracture. There is a vertical fracture through the sacrum that is not visible on this conventional radiograph. Straddle fractures are bilateral fractures of all of the pubic rami. The fracture fragments are usually elevated relative to the remainder of the pelvis, and they are frequently associated with injuries to the urethra and to the bladder. This is an example of a straddle fracture. The P is on packing in the pelvis. You can see there are bilateral fractures of the ischia and bilateral fractures of the pubic bones. The fracture fragments in this case are not elevated. Pelvic dislocation is also known as a sprung pelvis. This represents severe trauma. Sprung pelvis is usually associated with injury to the GU tract. The normal size of the sacroiliac joint is usually from 1 to 4 millimeters. The normal size of the symphysis pubis is usually about 5 millimeters. In a sprung pelvis, these will both usually be increased in size. This is an example of a sprung pelvis. You can see that there is marked widening of the symphysis pubis, the red arrow, and both sacroiliac joints, the yellow arrows, are widened. A bucket handle fracture is rare. It is a fracture of the anterior arch and the contralateral posterior arch. This is an example.
Now, another thing is, if you look, there's lines at certain places. That could be where healing occurred. See, this here is where a fracture could have been, right in here. Right. Because, here, right, you see that fracture, this fracture, right, throughout it, right. But this side, okay, is smooth, right, usually, right, where there is no fracture right there. Oops, sorry, another vagina shot.
In which we see a fracture of the ischium on the right, a fracture of the pubic bone on the right, and we can also see disruption of the sacral lines on the left, which indicate.
So again, we see the sacrum, right, is way over here, right. This here is the spinal cord, and it's supposed to be in alignment straight down, right? So mine's way over there, pushed to the left. Also, the pelvic bones on the left and right appear to be similar to Mickey Mouse ears rather than a traditional male pelvis, right? Well, you might ask, well, why are you going over this, Shane? Because I'm asking God to do what's called morph the bones back as they were before the injury, right? Now, all you can do is ask for this to occur, and it may take time for it to occur, but you're asking, right? Now, Paul inquired of the Lord about a problem which some people think has to do with when he was struck blind, right?
A retrograde urethrogram, a rug, is usually performed prior to the insertion of a Foley catheter so as not to worsen the condition. This is an example of a rupture of the posterior urethra. You can see the contrast in the urethra, and then a amorphous collection of extraluminal contrast indicated by the red arrows that represents a contrast which is leaking out of the urethra through a tear. A ruptured bladder should be suspected when there is a straddle fracture or a sprung pelvis. They are divided into extraperitoneal ruptures, which are more common than intraperitoneal ruptures, and a CT or a retrograde cystogram is usually necessary to demonstrate the rupture. Extraperitoneal ruptures, the contrast remains adjacent to the bladder. In an intraperitoneal rupture, the contrast usually flows freely as a result of rupture of the dome of the bladder. This is an example of an extraperitoneal bladder rupture. The B is on the bladder. There is contrast in the bladder. And you can see that there are fractures of both the superior pubic rami and both ischia. The red arrow is pointing to extraluminal contrast, which is adjacent to the bladder, that represents the extraperitoneal bladder rupture.
There's a sacrum still again in the center.
This is a CT scan of an extraperitoneal bladder rupture. The B is on the bladder. There is contrast in the bladder. There's also a Foley catheter just below the B. There's air in the bladder that was introduced when the Foley was first inserted, and the red arrows are pointing to contrast, which is extraluminal in location, but surrounding the bladder, characteristic of an extraperitoneal rupture. This is a CT scan of an intraperitoneal bladder rupture. The B is on the bladder, and you can see the contrast indicated by the red arrows, which is now flowing freely through the peritoneal cavity and which is surrounding the loops of bowel in the peritoneum. This is a conventional radiograph of an intraperitoneal bladder rupture. The contrast was administered into the bladder through a cystogram, and you can see that the contrast flows freely through the paracolic gutters. This is your mini quiz based on the material that we've just covered. Here's a 78-year-old with hip pain following a fall. Examine this image. You can pause your computer or MP3.
That's what happened when he fell. How high we don't know. How high we don't know.
Well, this individual has a fracture of the anterior arch. The red arrow.
See, that's what I mean, right?
Of the superior.
Usually, if you fall straight down, that is part of how it would break. But it wouldn't be pushed in, right? That's like your strut with weapons.
With hip pain.
Exactly. Now, if someone's striking you, and it's 20 days later, right? Is that malice, right? That's malice. They're striking you with, right? Yep. Because if you did something with your stepdaughter, why didn't they go to the police? No. Because they did something questionable themselves, right? See, if you're on base and someone attacks you, right? Or not, right? You have to be vulnerable to that person for them to attack you. And there usually has to be more than one person attacking you, right? Especially if you studied in martial arts, right? Unless it's someone you wouldn't really fight back, right? But there again, right? You would also have to get off base without an ID. And make sure you can get back on base as well. See, that would be too much attention for the person to attack you off base, right? You know what I mean there too, right? Mm-hmm. Mm-hmm. Mm. Now, I've been walking on the injury since 1994. It's 2020 now. That's over 25 years, right? And I can still walk and function.